3 o'clock in the morning, I got up, and when I got up, my arm fell and banged against the wall, but I didn't feel my arm. And that is the most bizarre experience that I've ever had. Stranger than that was realizing I'm having a stroke. Going into the emergency room changes everything. I'm scared, obviously. It's as if you have no power, you suddenly become anonymous, and you're looking around at the emergency room thinking, oh my God, this could be it. As the doctor walked by, he got down on one knee and he smiled and put his hand on my knee and said, tell me what's going on. And he did it with a kind of, we've got time for this. He did it with compassion. He did it with a lot of heart. It was like there wasn't anyone else in the room except the two of us. And for that moment, I wasn't afraid. For that moment, I wasn't alone. And in that moment, I felt like there was something good that could come out of this. And I decided that at that point, the hospital was going to be my family. And it was actually a positive experience from that point forward. Patient-family-centered care means let's find out what the patient thinks of this experience every step of the way and how we can intervene in language and in behavior in a way that makes sense. So I joined the Patient Family Advisory Council in order to figure out if there's anything I could do, given my experience with my stroke, that would be helpful. Looking at all the different things that the hospital could do from the patient's point of view. And I noticed things like papers that we had, forms that we had that we gave to patients that read like something that a lawyer might have sent to the AMA. We were thinking together as patients what it's like when you're overwhelmed with whatever's going on with you, trying to make sense of something in medicalese. It needed to be more invitational. So what we did is we looked at all the different things the patients sign and looked at the conversational English and how that could work. So we revised, I think, probably 8 or 9 forms. Doesn't seem like a big deal that all of a sudden we have a whole different way of presenting ourselves to the patients. It's the hospital making a commitment to hear from the people they're serving and have it be as important as the service they provide. That is a huge impact. For a very long time, what patients said was just what patients said. Now what patients say is part of what drives the system. My name is Bob Luckin, and I believe that listening to patients transforms everything in healthcare.